Social stratification refers to the hierarchical arrangement of individuals or groups within a society based on various factors such as wealth, power, education, occupation, and social status. It's a system that categorizes people into different layers or classes, creating distinct levels of privilege, opportunities, and resources for each group. Key points about social stratification. Inequality. Social stratification leads to unequal distribution of resources and opportunities. Those at the top of the hierarchy typically enjoy more advantages, while those at the bottom face disadvantages. Layers or classes. Societies often have different social classes, such as upper class, middle class, and lower class. These classes are defined by economic factors, lifestyle, education, and social influence. Mobility. Social mobility refers to the ability of individuals or groups to move up or down the social hierarchy. Vertical mobility is the movement between different levels, while horizontal mobility involves changing positions within the same level. Caste and class. Some societies also have systems like castes, which are rigid social groups determined by birth and often have religious or cultural significance. Social classes are more fluid and can change over time. Factors of stratification. Social stratification is influenced by various factors, including economic wealth, income, education, occupation, race, ethnicity, gender, and inherited social status. Impact. Social stratification can have profound effects on individuals and society as a whole. It can influence access to education, healthcare, political power, and basic needs. It can also shape opportunities for personal and professional growth. Functionalism and conflict theory. Sociological perspectives on social stratification include functionalism, which suggests that stratification is necessary for maintaining social order, and conflict theory, which views stratification as a result of power struggles and exploitation. Global stratification. Social stratification isn't limited to individual societies, it also exists on a global scale. Countries are categorized as developed or developing based on their economic and social indicators. Social mobility policies. Many societies implement policies and programs to promote social mobility and reduce inequality. These may include educational reforms, affirmative action, and wealth redistribution measures. In summary, social stratification is a fundamental aspect of societies that shapes the opportunities and experiences of individuals and groups based on their positions within the hierarchy. It's a complex phenomenon influenced by a multitude of factors, and efforts to address its negative impacts often involve policy changes and social awareness. Stress management is crucial for maintaining overall well-being and mental health. Here are some tips to help you effectively manage stress. Identify stressors. Recognize the sources of your stress. Understanding what triggers your stress can help you find ways to cope with or avoid these situations. Practice mindfulness and meditation. Engage in mindfulness techniques or meditation to stay present and reduce anxiety. These practices can help you manage your thoughts and emotions more effectively. Physical activity. Regular exercise releases endorphins, which are natural mood lifters. Engaging in physical activity, whether it's walking, jogging, yoga, or any other form of exercise, can significantly reduce stress. Healthy eating. Maintain a balanced diet rich in nutrients. Avoid excessive caffeine, sugar, and processed foods, as they can contribute to feelings of anxiety. Adequate sleep. Prioritize sleep and establish a consistent sleep routine. Lack of sleep can exacerbate stress, while quality sleep can improve your ability to cope with challenges. Time management: plan your tasks and activities to avoid feeling overwhelmed. Break tasks into smaller, manageable steps and set realistic goals. Social support: spend time with friends and family who provide emotional support. Talking about your feelings with someone you trust can help alleviate stress. Relaxation techniques: practice relaxation methods such as deep breathing, progressive muscle relaxation, or visualization to calm your mind and body. Engage in hobbies: dedicate time to activities you enjoy. Hobbies can provide a positive outlet for stress and help you relax and unwind. Limit technology: reduce screen time, especially before bed. Constant exposure to digital devices can contribute to stress and disrupt sleep patterns. Set boundaries: learn to say no when necessary. Setting boundaries in both personal and professional aspects of your life can help prevent overwhelm. Seek professional help. If stress becomes overwhelming and unmanageable, consider reaching out to a therapist or counselor. They can provide guidance and techniques to cope with stress. Positive self-talk: challenge negative thoughts and replace them with more realistic and positive ones. Reframing your perspective can reduce stress levels. Time for yourself: dedicate time to self-care activities that rejuvenate you. This can include reading, taking a bath, practicing a hobby, or simply spending quiet time alone. Laugh and have fun: engage in activities that make you laugh and experience joy. Laughter has been shown to reduce stress hormones and promote relaxation. Remember that everyone is different, so not all strategies will work equally well for everyone. It's important to experiment and find the combination of techniques that suit your personality and situation best. If you find that your stress levels are consistently high and interfering with your daily life, seeking professional help is a wise step to take. Vital health statistics are crucial indicators that provide insights into the health status of populations. They help governments, healthcare organizations, policymakers, and researchers understand health trends, identify areas for improvement, and allocate resources effectively. Here are some vital health statistics and their usefulness. Life expectancy. Life expectancy at birth is the average number of years a newborn is expected to live. It reflects the overall health and quality of life in a population. It's used to assess the general health and well-being of a society and to compare health outcomes between different countries or regions. Infant mortality rate. The infant mortality rate is the number of deaths of infants under 1 year of age per 1,000 live births. It's an important indicator of the quality of maternal and child health care and overall living conditions. High infant mortality rates can point to issues such as inadequate prenatal care, lack of access to clean water, and insufficient nutrition. Maternal mortality ratio. This ratio represents the number of maternal deaths per 100,000 live births. It indicates the safety and quality of maternal health care during pregnancy, childbirth, and the postpartum period. Monitoring this statistic helps identify gaps in maternal care and implement interventions to improve maternal health. Child mortality rate. Under 5 mortality. This rate measures the number of deaths of children under 5 years old per 1,000 live births. It provides insights into the overall health and access to healthcare for young children. High child mortality rates often indicate issues like malnutrition, infectious diseases, and inadequate healthcare services. Crude birth rate. The crude birth rate is the number of live births per 1,000 people in a given year. It helps assess population growth and age distribution. Changes in birth rates can influence the need for healthcare services, education, and social programs. Crude death rate. The crude death rate is the number of deaths per 1,000 people in a given year. It provides insights into overall mortality trends and can be used to identify emerging health threats or improvements in healthcare access. Prevalence of chronic diseases. Monitoring the prevalence of chronic diseases such as diabetes, cardiovascular diseases, and cancer helps identify the burden of these conditions on a population. This information guides preventive measures and healthcare resource allocation. Healthcare access and utilization. Tracking statistics related to healthcare access and utilization, such as doctor visits, hospital admissions, and vaccination rates, helps assess the effectiveness of healthcare systems and interventions. Obesity and overweight rates. These rates indicate the proportion of the population with excessive weight, which is associated with a higher risk of chronic diseases. Monitoring these rates helps design interventions to promote healthy lifestyles. Infectious disease incidence. Monitoring the incidence of infectious diseases like HIV/AIDS, tuberculosis, and influenza helps in disease surveillance, early detection, and response to outbreaks. Mental health statistics. Tracking mental health indicators, such as rates of depression, anxiety, and suicide, helps identify mental health trends and guide mental health support and services. These vital health statistics provide valuable insights into the health of populations, enabling informed decision-making, policy formulation, and targeted interventions to improve public health outcomes. They contribute to a comprehensive understanding of health trends and disparities, ultimately leading to better health outcomes for individuals and communities. Midwifery and gynecological nursing are specialized fields within nursing that deal with reproductive health, childbirth, and women's health. There are several ethical and legal considerations that healthcare professionals in these fields must adhere to in order to provide safe and patient-centered care. Here are some key ethical and legal aspects related to midwifery and gynecological nursing. Ethical considerations. Autonomy and informed consent. Respect for patient autonomy is essential. Healthcare providers should ensure that patients are fully informed about their condition, treatment options, and risks, allowing them to make informed decisions about their care. Confidentiality. Protecting patient privacy and maintaining confidentiality of sensitive information is crucial. Nurses and midwives must uphold patient confidentiality and only share information on a need-to-know basis. Cultural sensitivity. Being culturally competent and respectful of diverse backgrounds and beliefs is important. Nurses should provide care that is sensitive to patients' cultural, religious, and personal preferences. Non-discrimination. Healthcare professionals should provide care to all individuals without discrimination based on factors such as race, gender, sexual orientation, or socioeconomic status. Respect for choices. Midwives and nurses should respect the choices and decisions of patients, even if those choices differ from their own personal beliefs. Empowerment and advocacy. Empowering women to make informed decisions about their reproductive health and providing advocacy and support are ethical imperatives. Continuing education, staying updated with the latest evidence-based practices and advances in the field is ethically important to provide the best possible care. Legal considerations. Scope of practice. Nurses and midwives must practice within the scope defined by their licensing authority and adhere to regulations that outline what procedures and interventions they are allowed to perform. Informed consent. Healthcare providers are legally obligated to obtain informed consent from patients before performing any medical procedures or treatments. Consent should be voluntary, informed, and without coercion. Documentation. Accurate and complete documentation of patient care is essential for legal and continuity of care purposes. This includes documenting patient interactions, assessments, interventions, and outcomes. Malpractice and negligence. Healthcare providers can be held liable for malpractice or negligence if they fail to provide the standard of care expected of a reasonably competent practitioner. Privacy laws. Adhering to laws such as the Health Insurance Portability and Accountability Act (HIPAA) is crucial to protect patient privacy and confidentiality. Reporting obligations. Nurses and midwives are mandated reporters for certain situations, such as suspected child abuse, domestic violence, and infectious diseases. Collaboration. Collaborating with other healthcare professionals within legal boundaries ensures comprehensive and effective patient care. Medication administration. Nurses and midwives must adhere to medication administration protocols and legal guidelines to ensure patient safety. Licensure and certification. Holding valid and current licenses and certifications is a legal requirement to practice as a nurse or midwife. It's important for healthcare professionals in midwifery and gynecological nursing to have a strong understanding of both the ethical principles and legal regulations that guide their practice. This ensures patient safety, quality care, and professional integrity. Microorganisms, also known as microbes, are diverse microscopic organisms that include bacteria, viruses, fungi, and protozoa. They play essential roles in various ecosystems, from promoting nutrient cycling to causing diseases. Here is a classification of microorganisms and factors influencing their growth. Classification of microorganisms. Bacteria, single-celled prokaryotic organisms with various shapes, example, cocci, bacilli, spirilla. They can be beneficial, example, gut bacteria aiding digestion, or pathogenic, causing diseases. Viruses, tiny particles consisting of genetic material, DNA or RNA, enclosed in a protein coat. They are not considered living organisms because they require a host cell to reproduce. Fungi, eukaryotic organisms that include yeasts, unicellular, and molds, multicellular. They play roles in decomposition and nutrient recycling, and some can cause infections. Protozoa, single-celled eukaryotic organisms that often move using structures like cilia or flagella. They are found in aquatic environments and can be free-living or parasitic. Factors influencing microbial growth. Nutrients. Microbes require nutrients such as carbon, nitrogen, phosphorus, and trace elements for growth and metabolism. The availability and composition of these nutrients influence microbial growth. Temperature. Microbes have specific temperature ranges for optimal growth. Psychrophiles thrive in cold temperatures, mesophiles prefer moderate temperatures, and thermophiles thrive in high temperatures. pH level. Microorganisms have pH preferences for growth. Acidophils prefer acidic environments, alkaliphiles prefer alkaline conditions, and neutrophiles grow best in neutral pH. Moisture. Adequate moisture is essential for microbial growth, as it facilitates nutrient transport and metabolic processes. High humidity can promote microbial growth, while drying inhibits it. Oxygen availability. Oxygen requirements vary among microorganisms. Obligate aerobes require oxygen, obligate anaerobes cannot tolerate oxygen, and facultative anaerobes can grow with or without oxygen. Salinity. The salt concentration in the environment can affect microbial growth. Halophiles thrive in high salt conditions, while halotolerant microbes can tolerate some salt. Osmotic pressure. Osmotic pressure, determined by solute concentration, can impact microbial growth. Some microbes are adapted to high osmotic pressure, such as in hypertonic environments. Light. Light is a growth factor for photosynthetic microorganisms like algae and some bacteria. It's crucial for their energy production through photosynthesis. Competition. Microbes can compete for resources in their environment. Competition among microorganisms can influence their growth rates and interactions. Inhibitors and antimicrobial agents. Presence of inhibitory substances, such as antibiotics produced by other microorganisms, can affect growth. Similarly, the use of antimicrobial agents can control microbial growth. Physical barriers. Physical barriers like biofilms or host immune responses can influence microbial growth. Biofilms provide protection, while the immune system fights invading microbes. Genetic factors. Genetic traits within microorganisms can influence their ability to adapt and grow in specific environments. Understanding these factors is crucial for various applications, from controlling microbial growth in food preservation and medical settings to studying microbial ecology and developing microbiological techniques.